So, good morning, distinguished guests, professor, ladies and gentlemen. My name is Kodchaporn Teekatananont, the fifth-year medical student from Phramongkutklao College of Medicine. It's my pleasure to present to you our research in the title of Photographing Injury Used in Exploring Work-Related Hand Injury from Rubber Cultivating Process, a Mixed Method Study. So, rubber cultivating is the second most famous agriculture in Thailand, but we only found one research which take part in southern Thailand that is show that the hand injury is the most injured body part. So they lead to our objective. This mixed method study aims to determine the incidence and the associated factor for the work-related hand injury and increase understanding from rubber cultivating process in last cultivating season in Thakranang Sanam Chai Khet district, Sasengsao province. So this diagram will roughly show you about the rubber cultivating process. It's divided into three stages: tapping, acid mix, and rubber collecting, and they may cause the injury in penetration, laceration, or the chemical irritation. So our method, we use the quantitative part. We use the standardized questionnaire to collect the data, then analyze it with data by using Poisson regression and chi-square. And also, in-depth interview was used to collect the qualitative information, and content analysis was used to analyze this information. So moving on to our quantitative results, after use the inclusion and the exclusion criteria, we got the total participant of 206 rubber farmers. Number of at least one injury participant or our cumulative incident is 107 or 51.94%. All of these participants had the incident from May 2023 to February 2024 for 5,023 events or equal to 47 events per person. So chemical injury was ranked as the most common type of injury. Around 57%. We describe only first-hand events, and after that is laceration and the abrasion. In terms of severity, around 36% of all participants got the nail trauma, which is related to the chemical injury, but most of the events are the minor events because only 9 participants seek for the hospital treatment and only 3 of them got the work suspended. So the factor that associated with the frequency of hand injury per total work hours, we focus on the two important protective factors. After looking the adjust incident rate ratio, as you can see, both two factors can decrease significant amount of hand injury. So our photographic result, these are some example of the photograph that we took. We took approximately 27 pair of hand, or around 13% of at least one injury participant. After we analyze, we got the most common part in the extensor area are nails, and the flexure area are carpal tunnel to A to pulley. So our qualitative result, we conclude that the photographic and in-depth interview show more aspects about the factor, including type of work, skill, protective equipment, type of the equipment, all of this associated with a hand injury. For example, as you can see, compare about these two pictures or the difference that you can see. If we use only the quantitative part, we may conclude them as the nail trauma. This is where the photographic take part because they can show you more about the severity or the complication. Okay, so next is the in-depth interview. One participant said that in the first months of the cultivating season, he got a lot of hand injury because he used the unfit glove that lead to the leak of the acid into the hand. So after he decided to change the brand and the size to the fitted glove, he got like less than the hand injury compared to the first month. We also interviewed some of high work experience and no injury in the last cultivating season participants. He said that the different equipment, such as type of knife, type of work, or the glove, strongly associate with the hand injury. Okay, so our conclusion of our 206 participants, more than 50% had at least one injury, resulting in 5,023 total injury. The photograph and the in-depth interview also support this theory. So bearing gloves should be recommended because they can decrease around 50% of hand injury and should more concern about the suitable equipment for the farmers. Thank you for your kind attention.
Excuse me. I may lost some point when you mentioned about your qualitative result. So the sample size of your qualitative uh, assessment is come from those who have injury, right?
Yes.
Have you ever, I mean, did you explore the association or, I mean, sorry, the proportion of factor among those non-injury cases?
Oh, in the qualitative part, if
Uh-huh.
the in-depth interview, we interview all of the participants.
Uh-huh.
But in the photograph, we only took the photograph that the participant that had injury.
Very good.
Yeah, so the factor in the in-depth interview, we also interview them about the factor in the group that don't have injury too. Yes. So this is why we got the last one that we told you, the high work experience and no injury group. Yes, and he also say that if we change the type of knife or the type of glove, they can decrease amount of the hand injury too.
Very, very interesting and informative studies. But I just curious why you so emphasizing on the photographing injuries, because you found so many things and you found the recommendation from your analysis already, but in your title and in conclusion, you just emphasize on imaging, photographing. I don't understand that.
Okay, actually, this research is the component of our main research. Our main research study about the risk factor, association factor, and the incidence of the hand injury among the rubber farmers. So we decided to show the title of the components. I'm so sorry, but in this one, I show you all of the research that we got from our main research and our components. Um,
I think we have time for questions. Can you clarify the 47 event per person? Is that lifetime or just 1 year of being in a study?
in this study, we study only in the last cultivating season.
Okay.
It takes place on May 2023 to February 2024. When we ask them, they say that some of them say that they have the new trauma like every 2 days or every 3 days because that is the time that they collect the rubber, and some of them use bare hand and some of them use glove. So that's, that is why we have a lot of event per person in last cultivating season. And we decided to show the photograph because I think it can show you more about the type of injury that they has and their scar, and they didn't receive good treatment, so it has all of the scar on their hand. Thank you so much.